Scano, Sago, good day, Six Nations. Today is Thursday, April 16th, 2020. I hope this message finds you at home, healthy, and safe with your families. My name is Lori Davis Hill, Director of Six Nations Health Services, and I'm here to share today's COVID-19 response update. I'll start with the most recent numbers. As of this morning, we have done 191 tests here at Six Nations. Of those tests, there have been 121 negative results. Several tests were done yesterday, so it will be a few days before we receive those results. We have no new cases of COVID-19 confirmed in Six Nations territory. To date, we have had 9 positive cases. Of those, we have reported 1 death. 7 of the cases are now considered resolved. This means we have 1 active case of the virus in our community that we know about. This is good news. In order to better understand how Six Nations has been impacted, today we will be releasing a new visual that shows how our numbers compare to other communities. All of the surrounding areas have different numbers of people in their total population, so we can't compare our numbers directly. Six Nations has a published on-reserve population of 12,848, but Hamilton has a population of 579,200. In order for us to compare our cases to the other populations, we take the total number of positive cases, 9, and divided by our total population of 12,848, and this is called the prevalence. Then we multiply that number by 100,000. We do this for each of the surrounding areas so that each area is in cases per 100,000. Using this method, we can then report that in comparison. Haldom and Norfolk has 137 cases per 100,000 people. Six Nations has 70% 70 cases per 100,000. Brant County has 49 cases per 100,000, and Hamilton has 5 cases per 100,000. So we at Six Nations must remain on guard to keep the virus out of our communities and out of our homes by monitoring ourselves and our loved ones for the symptoms of COVID-19. Symptoms include fever, that's 37.8 degrees Celsius or higher, any new or worsening acute respiratory illness symptoms such as cough, sore throat, sneezing, shortness of breath, nasal congestion, difficulty swallowing, runny nose, or a hoarse voice. The list has also been expanded to include atypical or only sometimes seen symptoms in elderly persons or children. You can find this list on the Six Nations COVID-19.ca website. If you are experiencing even one of these symptoms, it is important that you call the Six Nations COVID-19 Assessment Center at 226-446-9909 or at the toll-free number 1-855-977-7737. A nurse will carry out an assessment with you over the phone, asking you a few simple questions to determine whether or not you need a COVID-19 test. If a test is needed, the nurse will provide you with instructions to take part in a drive-through test. The test is easy. You don't even have to get out of your car, but it is so important that you could literally help save lives. We have the materials we need to complete the testing process for our community members. We need you to come forward if you have any of the symptoms so we can find the virus if it is here in the community. Don't be afraid to be tested. The earlier we know you have the virus, the faster we can move to stop the spread. Other things you can do to protect the health and safety of your family and friends include staying home. The most important thing you can do to avoid the virus is to stay away from any people who might be carrying it. Do not go into public places unless it is absolutely necessary. If you absolutely must go out, make sure to keep a distance of 2 meters or more from any other person around you. Wash your hands regularly and for at least 20 seconds. Carry hand sanitizer with you if possible. Clean and disinfect your bodies, homes, and workplaces often. Cough and sneeze into your sleeve, your elbow, or a tissue, and make sure to wipe off any items that you're bringing into your home. Let's end this virus and get back to normal as quickly as we can by using this information. I will continue to join you daily to share these important updates along with health and safety information we need to keep our community safe. Stay home to protect the health and lives of everybody we love. Please keep our Six Nations healthcare and emergency service professionals on the front lines of this pandemic in your thoughts and in your prayers. They go to work every day and literally put their own health and safety on the line for you. Please stay home for them. Please stay home for all of us. Stay safe and stay well. Nyawa.